Hi, everyone. I'd like to welcome you back to the Emotional Resilience series. Thanks for joining us today. With us, we have two mental health professionals, Megan Beyer and Lucy Carrier. Thank you, ladies, for joining us. Today, they'll be speaking about effective conversations with healthcare professionals and loved ones. We'd also like to invite you to check out the rest of the Emotional Resilience series. Here are the 5 topics that we're covering this year. Each topic has a webinar and a toolkit. The associated toolkits include conversation starters, tips for proactive problem solving, and helpful resources. Now I have the pleasure of turning the presentation over to our speakers. Megan, take it away.
Thank you so much. So again, my name is Megan Beyer. I'm a psychologist at Johns Hopkins in Baltimore, Maryland. I've been working with people that have multiple sclerosis since about 2007, and almost all of the patients that I work with in my clinical and research practice have multiple sclerosis. I've loved being part of Can Do MS, and I've been with Can Do for close to 5 years now.
And yes, I am Lucy Carrier. I am a clinical health psychologist with the Cleveland Clinic in Las Vegas. And my practice focuses on individuals living with neurodegenerative diseases, which includes multiple sclerosis as part of my clinical practice as well. I have been working in the field of MS for 6 years, and I have been with Can Do for 5 years now.
So I first just wanted to go over a few learning objectives or what we're trying to accomplish with this talk. First, we want you to identify steps that are useful in preparing yourself and others for important and difficult conversations. We'll be touching on that quite a bit, how to manage difficult conversations. Understanding the unique components involved in conversations with your healthcare providers, your medical team, including advocating for yourself, shared decision-making, purpose and goals of treatment, and how to communicate all of those effectively with providers you know well and maybe providers you don't know as well. And recognizing common challenges and barriers in communication with family and friends, and additionally ways to overcome these.
So let's first start talking about how we communicate. And so this can occur in a wide array of different ways, from the words that we say, the tone in our voice, the expressions on our face, even our touch. Body language can also be a huge way in which we communicate our feelings and thoughts. Even thinking about emails, letters. The ways in which we communicate to others is quite varied. And so we want to think about all of these different ways in which we are connecting and trying to convey messages to others. So when we think about effective communication, we really think about that as the way in which it builds a foundation for trust, as well as how we convey respect. How we show that to others, and also too how we hope to receive that in return. It's also a way in which we develop and we maintain intimacy, emotional intimacy, with those who are closest to us, but also too within our network, thinking about our medical providers and feeling as though we're being heard and we're experiencing that respect.
We also want to acknowledge that communication is really not easy. It's very difficult to communicate effectively, and this is something that you'll probably have to practice throughout your lifetime. We often get flooded with emotions, or we get stuck in our own heads or our own memories when we hear somebody else's responses. We sometimes have difficulty wording what we want to try and say, or we don't exactly know how to get our point across. So we want to learn how to accurately convey our ideas, respect the other person that's in front of us, send a clear, unambiguous message, invite conversation rather than shutting it down, and really give that other person time to respond so that you can understand them correctly as well.
So as we start to transition into thinking about the barriers to effective communication, the first variable we want to really think about is time and how incredibly limiting that can be and can get in the way of being able to really have the opportunities, right, to communicate, to use these skills. So when we think about how we communicate first to our medical team, we think about how time can be so limiting to really conveying what it is that's bothering us, what it is that we really want to bring to the forefront in that appointment. And so it could be really limiting in that you may only see your doctor a few times a year. So you may not get that face-to-face opportunity of really being able to say, this is what's bothering me. The appointments are oftentimes short. And so it's hard to really think about, how do I prioritize these issues? How do I really think about what questions are most important or pertinent for me in the moment? You may also be a part of a practice where there's a different provider each time. You may not have that continuity or consistency with the same provider. So it can be hard to kind of build that intimacy. So you may feel as though you're kind of having to retell your story with each new provider, which can really be limiting because you have to think about time. And again, how do I balance that? Conversely, in thinking about your family, there simply may not be a good time or place because of all of the other demands between you and that family member or your significant other or a parent or a child. Other responsibilities may simply just take priority, whether that be with work, caretaking, child rearing. Those things may just kind of get moved up to the top of your priority list, and talking about your MS or talking about aspects that are important or more intimate may fall down the list. So how might we go about kind of tackling some of these challenges? So in thinking about your medical team, we really want you to think about those questions, really thinking about those priorities that you do want to discuss. Is there any way you could maybe submit those prior to, given your medical record system? Can you think about contacting the medical team beforehand with those questions, submitting them, but even coming into the appointment with a list, having that there. What are your top 3 concerns that you really want to convey? It may not be all of them. You may have 6 or 7, but really thinking about, okay, with the time I have, this is what I want to share. Thinking about your family, how might we overcome the time issues? One thing I might suggest is, can you schedule some time? Really kind of saying, all right, you know what, let's have a time that we're going to meet, even if it's just a brief check-in, or it could be a 30-minute time that you set aside to really kind of give yourself the opportunity to speak. Another thing we want to think about is, what is it you hope to accomplish? And really kind of using that as a way to frame going into that discussion. Is it, hey, we have this one issue we really need to talk about and hopefully solve? Is it that I'm simply going for support, or maybe I just want to feel heard? Can you frame it that way? And kind of having that in mind as the one initiating it may really help to guide that discussion and kind of keep it focused as much as you can with the time.
Another barrier to communication that we frequently hear is people feeling dismissed or uncertain. So sometimes when we're thinking about our medical providers, I often hear people saying to me, the patients that I work with, that their doctor doesn't get it, or they just don't believe me. They might come to an appointment with symptoms. This often happens before diagnosis, maybe even if you're uncertain if you're having an exacerbation or a pseudo exacerbation. So sometimes people feel like their doctor just doesn't get it, or they aren't really believing the symptoms that they're coming in with. They may often also feel like that they're not understanding what the doctor is saying to them. So the doctor might be using a lot of jargon or running through studies very quickly, and they're not understanding the words or the content of what the doctor's trying to get across, or maybe even what the doctor's recommending. And maybe the doctor is really concerned about something like your disease modifying medication, but they're not spending as much time on emotional symptoms, urinary symptoms, sexual symptoms, things that may also be really important to you in terms of your quality of life. So they may feel like the doctor isn't focusing on the concerns that they specifically have, and that they're not answering the questions that you came to the appointment with. So all of those kinds of concerns can really make you feel dismissed or uncertain about how to proceed. With family, this often looks like family members not knowing how to talk about really difficult topics, that there's a lack of information about how to proceed, that this is something that's entirely new. So if you're newly diagnosed, maybe you and your family don't really have a common language around some of the symptoms that you're experiencing. Or even if you've been living with MS for a really long time, maybe there are lots of things happening like the COVID pandemic, and there's a lot of uncertainty and lack of information, and maybe not a common language about what level of stress that is adding to you and your family. And again, we often hear, just like with the physicians or the medical team, that sometimes it feels like family and friends just don't get it. They really don't understand your symptoms, or they feel like maybe when you say you're tired, oh, I get tired too. No, they don't. It doesn't feel like they really get the kind of symptoms that you're experiencing. So, how do we address these things? With the medical team, I often recommend that it's okay to get a second opinion or talk with somebody else in the clinic. So if you're not sure what the recommendation is, or that you're hearing some uncertainty in your provider about what type of disease modifying medication to be on, or maybe even ways to address symptoms that you've been living with for a long time, it's worth getting a second opinion if you can do that. And you can choose to stay with your current neurologist, or you can choose to move to a new neurologist. But getting a second opinion will give you a little bit more information about whether or not this is consistent with what you were thinking, or maybe there are some new options that you weren't aware of. You can also talk with a nurse or a physician's assistant in the clinic, and they can often give you some additional time and perspective on concerns that you have. If a doctor or a provider is using jargon, or they're talking too quickly, or they're not answering your concerns, it's okay to politely ask them to stop, or to slow down, or to define what they're saying to you. Maybe even ask questions, or let them know, hey, I'm really losing you here. I'm not exactly sure what you're recommending. Can you write that down for me? Or, is there, can you kind of lay this out in a bullet point list for me so that I really understand what you're saying? Um, it's often helpful to providers if you send a bulleted list of concerns ahead of the visit, so that they know what you're concerned about, so that they can also prioritize the appointment. And if you haven't gotten all your questions answered, tell them that you have more questions. Acknowledge that there may not be enough time in this visit to answer them all, but ask how you can proceed. Can I have a phone call? Can we do an email exchange? Can we send things through the medical record system? Can I schedule with a nurse or a physician's assistant so I can get some of these questions answered? Often when we feel that our family doesn't get it, or we feel dismissed or uncertain about our family, um, you know, many times they're learning along with you, maybe even at a slower pace than you, about what this MS thing is all about. So sometimes it's helpful to bring your family or a friend to the doctor's appointments with you. If you have a particular symptom that you're concerned about, I recently just worked with somebody who was describing some symptoms that her daughter and partner really didn't get, or she didn't feel like they got it. So they watched a webinar together, and she was sending blog articles to extended family members so that they sort of understood her fatigue a little bit better. And that gave them some common language to talk about that difficult topic, or that so that they could understand that it's just not the normal type of fatigue that everyone experiences. Um, Also, it's going to take some practice to talk about difficult topics, and it will feel uncomfortable at times. So, sometimes to keep yourself from getting emotionally flooded, with difficult topics, trying to write down the main points and sticking to those main points when you're talking with family and friends can really be helpful. And sometimes it may be helpful to understand where your family or friend is coming from. Maybe they're scared and they don't know how to talk to you about this. So sometimes asking them questions to understand their perspective can really open the doors to mutual understanding.
So let's talk a little bit about how different coping or communication styles with others can be sometimes a barrier to effective communication. You know, in thinking about your medical provider, maybe they don't have the best bedside manner. Maybe they're not as warm and opening as you would like, or that fits your style. Or maybe they don't go into the depth of information that you're really wanting them to bring in. Or they're not bringing in the cutting edge research that you're really hoping will be kind of the topic of conversation, or, you know, saying, let me hear your questions. Maybe they feel a little rushed. And so you're feeling that too. And it's just not a good mix. You're just not kind of hitting it on the same page. And that can get in the way, right? As you feel, again, as Megan was saying, maybe you're feeling dismissed kind of in that moment of they're not getting it. And so another aspect that may kind of hinder your different communication styles may also be just the decision-making approach. You know, you may be, again, wanting your doctor to kind of walk you through step by step what they're thinking, why they're suggesting a particular disease-modifying medication, why they think physical therapy might be a great idea, or, you know what, I'd really like you to try this medication. Your depression is really becoming concerning to me. But maybe they're not giving the explanation that you're wanting. Or maybe they're giving you an abundance of information and you're thinking, just tell me what you think I should do. I trust you. I see you as my expert. I don't really know enough to kind of weigh in. So you tell me. So you can see how having those different styles, different approaches may again hinder that communication as well as that discussion, just that back and forth. You know, in thinking about how this may hamper your family, I'm sure each and every one of you can think about how you may differ from a partner or significant other or your child or your parent in terms of how you talk. We all have ways in which we communicate with one another. It just makes us who we are. And no style is better than the others. I think the important part is really thinking, okay, how do we try to find some commonality there? So again, you know, your partner or that family member in your life may want to know everything there is to know about MS, but not you, or vice versa. They want to know everything. Additionally, you may find that some are just going to want to talk more about things than you, or maybe that you're the talker and they're the really silent one. And again, it could be that simply it's not that they don't care or they're not interested. Maybe they just need to kind of process it on their own inside, and they're not kind of outwardly expressing the curiosity or you know, the comments that Megan was referring to in the previous slide. It's just that they're processing the information differently and maybe need to digest it before they're able to kind of ask you those questions. Additionally, we see, you know, coping and communication style barriers come through when we think about care planning. You know, you may be wanting to kind of think over the next 5 years, 10 years. Okay, we need to think about financially, where are we going to be? What if I need to leave the workplace? What if we need additional assistance at home in caring for the kids or taking care of the housework? I want to think this through. I want to think through all the different alternatives. And your family member may say, no, let's just wait and see. Let's take this kind of day to day, or vice versa. You know, your partner may want to kind of really nail things down and you're not wanting to. And so again, really kind of thinking through what that's like for the two of you. You know, what's that dynamic? Because it can be ripe for conflict, for disagreement, particularly if you're not clear with the other person where they're at in this.
We also regularly find that cognition is a huge barrier to communication, and it also seems to really impact people's confidence. Because if you can't get the words out or you can't get your point across in the way that you want to, sometimes you might have the feeling of, why should I even bother? Right? So, what we know about cognition is that as we get frustrated or as our heartbeat and our heart rate rises, it's often even more difficult to communicate or to listen. Often there's some research that shows that when your heart rate gets above 100 beats per minute, your executive functioning or your ability to problem solve and think through complex problems starts to turn off or turn down. And we go into this cognitive spiral where we are getting more emotional, we can't problem solve, we're getting even more frustrated, and it just spirals downward into until we either freeze, just shut down, or maybe sometimes explode. And so, some possible strategies for this is to grab a notebook. So, if you're feeling really frustrated and you're having trouble getting your words out or not sure how to get your point across, you might want to grab a notebook and start jotting down the main points that you're trying to make. Or you may even just want to jot down what the other person is saying, because you might be hearing them trying to respond, but they're taking too long to talk. And so you can't get your point out. And so you need to really write down what they're saying to follow the conversation and know what points to come back to. Often we want to confirm that what you've written down is correct, right? Because you're not only hearing what they're saying, you're writing it down and you're thinking of your own points that you want to make to each of those comments. And we want to make sure that what you're writing down is correct. And sometimes our partners, whether they have cognitive difficulties or not, don't always say what they mean, right? So they're in the heat of the moment as well, and they're saying things that are not helpful or are not actually clearly conveying what they're trying to express. So often what we can do is say, this is what I've heard you say, or this is what I wrote down. Is that correct? And then pause and give them time to really correct what they've said. Or often, sometimes they might just repeat it in a slightly different way that makes it a little bit more clear for you what they're saying. That pause also and hearing it in a different way may also give you some time to really think through how you want to respond. Take time away from the conversation if your emotions are too high. So, when our heart rates are up and we're getting emotionally flooded, we're not going to think clearly, and we're often not going to come to mutual understanding. So it's okay to take a break. Often we want to take about a 20 to 30-minute break from the conversation, but the main point is identify a time when you're going to come back to that conversation. So don't just drop it, walk away, and never come back to it. You really want to end the conversation, but end the conversation when you're less flooded. Clear communication can reduce your cognitive burden and emotional flooding. So again, I think as Lucy had pointed out earlier, coming to the table with 3 bullet points of what you really are trying to convey can also be really helpful for not only helping you get your language out or you get your communication out, but also making sure that you don't get taken down a rabbit hole. Often happens emotionally.
Yes, and so related to that piece, right, that intricate kind of interaction with the way we think and our emotions is really now thinking, how do those emotions get in the way? What are those specific emotions, those negative emotions that can be really triggering and can be quite overwhelming for some individuals, and for a lot of us, actually. So first we think about anxiety, right? Maybe the topic is just really too scary to talk about. It just induces a lot of fear, thinking about the future, uncertainty, all the what ifs. And so, in a way, to deal with that anxiety, we might just try to avoid it. We might just kind of shut down and say, yeah, we're going to talk about something else. Denial may also get in the way. You know what? Kind of thinking there's nothing to talk about. We're fine. We're good. We're not going to acknowledge it. In some respects, right, this can be adaptive when you think about we need to focus on what's at hand, not get too overwhelmed. But there's a fine line there where sometimes we just fail to acknowledge any aspects and we don't want to talk about it and we just shut down very, very quickly. That can also be problematic. There's also a factor too, I often hear in couples I work with of that protectiveness of, well, I just don't want to upset them. It's going to cause more damage in the short term or conflict if I mention it now. It's probably best we just wait. But what happens is you don't go back to it, right? As Megan was talking about, we really want to think about, okay, it could be really tough right now, but when can I come back to it? Can we come back to this in a couple days, honey? Or you know what, tonight I think I feel a little better. Or maybe in the morning we can revisit this. Guilt may also be triggering for some individuals. My feelings just aren't nice to me. It's just too much. I'm becoming such a burden to my family. How is this going to affect them? What are they thinking of me? How do I alleviate some of that additional responsibilities and roles I've placed on them? And so that guilt can just become overwhelming. There also may be embarrassment that get in the way. I can't talk about this. It's super uncomfortable to mention my bowel and bladder issues or sexual dysfunction. I don't want to admit that I'm depressed. That means I'm weak, that there's something wrong with me. So I just don't want to talk about it. And so when you think about these different emotions, I think it's important to recognize they usually don't occur in isolation, right? There's oftentimes a combination of these that vary in intensity depending on the situation, the triggers that may induce them, your history and who you are before MS, right? That factors into this too in terms of what emotions may be more upsetting than others. But as we think about too, those different coping styles and how others may respond to us, react to these emotions, we also want to think too and just try to remember that silence doesn't necessarily mean that someone doesn't care. It simply may be they just don't maybe know how to sit with those difficult emotions or respond to them. So trying to kind of keep that in mind that, all right, maybe you're trying to take a curious approach and you're quiet and you're contemplating. That's okay. I want to acknowledge that, but I also want to acknowledge I'd like to talk about this. So now we want to discuss this, or what are your thoughts on this? So kind of moving and working through that is important.
We also want to acknowledge that there's certain situations or environments that make communication even more difficult or can make it more complicated. So as we've been talking about medical providers and your doctors, there's often what is perceived as sort of a power imbalance. So if I'm upset with my doctor or I'm upset with them or I don't really think that they're hearing me, many people feel they can tell their doctor is going to them if they get an opinion because of that power imbalance. So with that, I think it's sometimes helpful to take a step back and recognize that you are an expert in yourself, you're an expert in your symptoms, and you're living with them day in and day out, and that that you and your physician or your medical team should be working as a team together in order to get to an ultimate goal of living your best life with the fewest number of symptoms that you're having to manage. So it is sometimes okay to say to your doctor in a polite way, hey, I just don't think you're hearing me, or, I really love working with you, but I do think I might want to try and get a second opinion. I think you'll find that most providers are open to that and okay with it. And if they're not, then that might give you some indication that maybe this isn't the right person for you. So it is okay, I think, in a polite way to express some concerns or discontent with your doctor. With our family members, we often get emotionally intense more quickly than we would with a family member, a friend, or a coworker, or even our medical team, right? So in anger management therapy, one of the things that I use with people if they're going through that is, how would you respond to this situation if your religious leader was in the room with you right now, or if your grandmother was in the room with you right now? So sometimes sort of imagining that that somebody who's not in your immediate family is in the room with you might help you manage your emotions better, because we tend to do that a little bit easier outside of our immediate families. And sometimes recognizing that we can become emotionally intense much more quickly with our immediate family members helps us sort of cue in to those body signals when you're starting to get emotionally intense. So just sort of checking yourself earlier. There's often a lot of stigma also, as Lucy was mentioning, around sharing mood symptoms, not only with your family, but also your providers. And, I've heard specifically some of my patients saying things like, this is really embarrassing for me to talk about. I don't want to share this with them, or I've only shared this with female providers. Or I've only shared this with male providers, or I can't talk to my psychologist about erectile dysfunction. There are a lot of things that have stigmas around them or that feel very embarrassing. Um, and so sometimes sort of taking a step back and saying, how can I talk about this in a way that gets it addressed, but makes it feel a little bit more comfortable? And some possible strategies there are maybe working with providers who are an expert in that area. So if there are concerns around bowel, bladder, or sexual dysfunction, sometimes working with a urologist or a pelvic floor therapist, people who deal with this day in and day out, and it's their bread and butter. Maybe you feel a little bit more comfortable talking to them than your primary care provider, your neurologist. And so kind of thinking through who you would feel comfortable talking through these symptoms with, or mood concerns with, can be really helpful too.
All right, so we've talked about some good strategies for how to overcome some barriers to effective communication, but really where we know the foundation for effective communication lies is in listening. So let's talk about then some tips for listening. And what works, what doesn't necessarily work, right? So really trying to, as Megan has kind of alluded to earlier, kind of trying to exhibit and demonstrate that effective and active listening, right? I'm listening for the themes, I'm listening for what's being said, I'm taking time now to then confirm, is this what you were indicating? Is this what you were trying to convey to me? And really making sure there's some consensus as to maybe what was said. Also, to body language is huge, right? We know this is the majority of how we communicate, and really thinking about where your eye contact is, how your arms are crossed, what's on your face, what are you exhibiting, removing those distractions, right? Having our phones across the room or in another room, right? As you're really trying to show, I'm here, I'm present, I am turned to you. Like my body is looking at you full on. You are my full attention. You have my full attention right now. We also want to think when we're listening to try to resist that urge to jump in, to clarify, to say, no, actually, that's not what I was indicating, or that's not what I said. Giving them that other person the floor to be able to express themselves, listen, right? You're practicing that because oftentimes when we're jumping in and we're interrupting, we're not listening. We're focused on what we're trying to say. We're focused on our rebuttal of, no, that's not it, or how you're going to explain your counter argument, if you will. And so it can kind of feel a little adversarial. And we really want to embody and really embrace that curiosity. As much as those emotions may be tough and kind of overcoming you, we want to avoid that reaction to form conclusions too early. So trying to resist that urge to kind of sit there, listen as much as you can, so that you can really kind of understand where that other person is coming from.
And so what are some tips, now that Lucy shared what to do when you're listening, what to do when you're talking? So number one, as we've already mentioned, it's really important to make time for talking. So if you don't talk about it, the conversation or the issue never gets addressed. And so I think sometimes if you don't do this naturally, it is helpful to start scheduling some time every day that you can check in with a family member, your friends, your partner, about any issues that may be coming up, or concerns, or things that you just want to share with them so that you feel more connected. You want to acknowledge differences in different coping and communication styles, like Lucy referred to earlier, where some people may be talkers and some may be listeners. Some may need to process internally. Some like to just process externally, and that helps them figure out what to do next. So notice how you communicate versus how your partner or family members communicate, and give some leeway for that, even if it's a little different than the way you might like to process things. Try and use I statements. I know this is something that we all learn a lot about, but it is really important to sort of talk about how you're feeling or how the situation is making you feel without being accusatory to the person sitting in front of you. Give that other person time to think and respond, especially if you know that your partner has cognitive difficulties. It may be that they need to think for an extra 10 seconds, 15 seconds, even 30 seconds about what you said before they're able to really respond. And let them have that time without rushing them, so that they are de-escalated, they are less frustrated, and so the whole conversation will be much more productive. We don't want to overgeneralize or say some things like you always or you never. We don't want to drip with sarcasm. Sarcasm really has a negative impact and can derail conversations very quickly. And no one can read your mind. So we often hear things like, well, they should just know how I feel, or they should know how to respond in these situations, or my partner should know that I like this thing or I don't like this thing. Well, often we think that the partner should know this or your family members should know these things, but they really don't. And so sometimes, even if it seems obvious to you, just saying that thing out loud can really help you and them act in a way that is much more productive and helpful.
So let's talk about some ways in which phrases or statements may be conversation stoppers that may simply just get in the way, and as Megan said, really derail the conversation that's going on between you and a family member or a significant other. So some things that may come up, right? So we've talked about barriers to effective communication. We've talked about some general strategies for how to be an effective listener, how to effectively communicate on the kind of the talker side of things. But these may come up in conversation. And really, we want you to think about how you might respond to these kind of in the moment. Again, emotions may be high, but we want to think about how we can practice these skills, because a lot of us aren't natural born effective communicators. It takes practice, right? You're learning a new skill, and we're human and we're going to make mistakes, and so too will our partners, right? And kind of how can we effectively de-escalate in the moments when you hear things such as, well, what's the use of talking about this? Or you may hear, if you really cared about me, you know when I needed help. You'd know effectively what I needed. Or, hearing, you always do this, or you never are there for me, or you never listen to me. Those can hurt. And we don't want those to be tools to derail the conversation. So, how might you, if you're on the receiving end of this, how might you respond? Really kind of thinking ahead, what are some talking points that you could have? Could you have a statement in mind, knowing if your partner is more likely to say one or the other, or one that we've not mentioned here? Is there a way that you could de-escalate that in the moment, where you can identify the emotion and really try to empathize with them in the moment to potentially de-escalate? So that you can kind of stay with it, right? We don't want the conversation to shut down prematurely, but we also want to be mindful of cognitive factors. We want to be mindful of that emotional flooding too. So there's a lot that goes on, right, when you're having these discussions that can come with a lot of emotion. Megan, is there anything maybe you want to add to this?
Yeah, absolutely. I mean, I think it's really helpful to take a moment and to maybe even pause the video right now and jot down, as Lucy mentioned, a few things that how you might respond to these. And I think sometimes, one thing that is really helpful is looking at the core that's behind some of these statements. So for example, if we take the first one, what's the use of talking about it? what's behind that statement? Many times it's a sense of uncertainty, it's a sense of fear, it's a sense of hopelessness, right? And so sometimes acknowledging that part of it can really open the door to communication and say, I know it may be feeling really hopeless right now. One of the reasons I think this might be helpful is X. Would you be willing to have that conversation with me? So sometimes acknowledging what the person might be feeling behind these statements can make them feel more heard and maybe be more open to a useful conversation.
Yeah, that's a great point. And you're going to be more likely to do that, right, if you can manage your emotions in that moment, because this takes some practice to kind of effectively separate that a little bit.
Exactly, exactly. So, one thing that we also want you to do is take a moment over this slide and the next one that Lucy's going to finish with. And again, it may be helpful for you to pause the video and jot down a few notes for yourself. So, of all the things that we've talked about today, can you make a note of one way that you'll try to communicate differently with your partner or other important people like your medical team as a result of this discussion? So are there any tips, even one tip that you found in our conversation today that could be helpful for improving your communication with either your medical team or your family members? And it may also be helpful to note some hot button topics or some things that typically derail conversations for both your family and your medical team.
Mhm. Yeah, and related to that, thinking about the topic, right, that may be particularly more difficult, as Megan mentioned, that as a result of this webinar today, you've thought about, gosh, this is just something we really don't get into much because of, these emotions or these different types of barriers. For instance, we just don't talk about the sexual dysfunction within our relationship, or I've really felt dismissed and hurt since my diagnosis. No one quite understands. And I really want them to understand this aspect of my disease and how it may affect me and the challenges I experience. And so we really want to challenge you to kind of think, what's one topic, right, that maybe you'd like to approach a little differently and use some of these skills for.
Awesome. Thank you both to Lucy and Megan today. And lastly, I'd also like to thank our sponsors for their generous support of this program. Have a great day.